Meningitis and encephalitis are two serious neurological conditions that frequently appear on the NCLEX exam. While they may seem similar, they affect different anatomical structures within the central nervous system. Recognizing the subtle differences between these two disorders is essential for both your nursing boards and clinical practice. Meningitis is defined as the inflammation of the meninges, which are the protective membranes surrounding the brain and spinal cord. In contrast, encephalitis involves the inflammation of the actual brain parenchyma, or the brain tissue itself. Both conditions often present with shared symptoms like fever and headache, which can make them tricky to distinguish. However, understanding the specific clinical manifestations is crucial for providing timely and life-saving nursing interventions. Meningitis is often triggered by bacterial, viral, or fungal infections that invade the protective coverings of the brain. Bacterial meningitis is considered a critical medical emergency that can rapidly progress to sepsis or permanent brain damage. The classic clinical presentation of meningitis is often described as a triad of fever, severe headache, and neck stiffness. In clinical terms, this neck stiffness is known as neutral rigidity, where the patient struggles to flex their neck forward. Patients often report intense nausea, vomiting, and photophobia, which is a painful sensitivity to bright light. On the NCLEX, look for mentions of positive Koenig's or Brudzinski's signs as key indicators of meningeal irritation. Koenig's, leg extension pain. Brudzinski's, neck flex, hip flex. Treatment for bacterial meningitis requires immediate administration of IV antibiotics and strict isolation precautions. Nurses must also prioritize fluid resuscitation and maintain constant, vigilant neurological monitoring for these patients. Encephalitis, meanwhile, is the inflammation of the brain tissue itself, most commonly caused by viral infections. The herpes simplex virus is a frequent culprit, though other viruses can also lead to this serious condition. Because the brain tissue is directly affected, patients often exhibit much more profound neurological dysfunction than in meningitis. Symptoms of encephalitis often include confusion, personality changes, and even hallucinations or seizures. You may observe a decreased level of consciousness or focal neurological deficits in patients suffering from this condition. These patients often appear significantly disoriented or display abnormal behaviors that indicate deep brain involvement. When answering NCLEX questions, if the scenario emphasizes altered mental status, prioritize encephalitis as your primary suspect. Unlike meningitis, neck stiffness is typically less prominent in cases of encephalitis, which helps you differentiate the two. Management for encephalitis focuses on antiviral medications and aggressive seizure management to protect the patient. Airway protection is a vital nursing intervention if the patient's level of consciousness continues to decline. Supportive care is essential to manage potential complications like rising intracranial pressure during the acute phase. To remember the difference for your exam, focus on the anatomical location of the inflammation. Meningitis affects the protective coverings, leading to classic signs like nuchal rigidity and light sensitivity. Encephalitis affects the brain tissue itself, leading to confusion, behavioral shifts, and seizure activity. Always remember that both conditions can lead to a dangerous increase in intracranial pressure. Nurses must perform frequent neurological assessments to detect any rapid decline in the patient's status. By mastering these distinctions, you will be much better prepared to tackle difficult NCLEX neurological questions. Confidence in your clinical knowledge allows you to identify life-threatening symptoms early in your practice. Remember that early recognition and rapid intervention are the keys to improving patient outcomes in both conditions. Keep these core differences in mind as you study, and you will be ready to handle these emergencies with confidence.